Welcome to my YouTube channel Medical Knowledge, where medicine makes sense. Today we will be talking about the benefits of breastfeeding. The newborns should be exclusively breastfed for the first 6 months of life, and for rest of 1.5 years, babies should be supplemented with other foods and milk in addition to mother's milk. Breastfeeding benefits the newborn, the mother, the family and the society together. If you like this video and want to watch more medical videos, then please do subscribe this channel. Benefits to newborn. Human milk has 60% whey protein and 40% casein, which is easier to digest. Lactose in human milk is easier to digest. The composition of milk varies according to the animal it comes from, provides the correct rate of growth and development for the young of that species. So a human baby should have a human milk and a cow baby should have a cow milk. Only vitamin K, D and iron needs to be supplemented in term babies, whereas in addition to vitamin K, D and iron in preterm babies, multivitamins, calcium and phosphorus should be supplemented. Human milk contains immunoglobulins such as immunoglobulin A, macrophages, lactoferrin and lysozyme, which helps to fight against bacteria, virus and prevent from disease to happen. The evidence says death due to diarrhea decreases by 14-fold if a baby is exclusively breastfed, and death due to respiratory illness is decreased by 4-fold, and by other communicable diseases by 3-fold. So, exclusive breastfeeding is very necessary. Risks of developing bronchial asthma and allergy are also reduced if a baby is exclusively breastfed. Breastfeeding helps to maintain physical and emotional bonding between the baby and the mother. The long-chain polyunsaturated fatty acids, which are present in human milk, are the precursor for Decosahexoconic acid, DHA, and arachidonic acid, which help in visual, immune, cognitive, and motor development. The evidence has shown that exclusively breastfed children are more intelligent and have a better grade in studies. The IQ of exclusively breastfed child is more by 8 digits. The arachidonic acid, decosahexoconic acid, lactose and salicylic acid help in brain development. Taurine and cystine, which are present in breast milk, help in neurotransmission. An exclusively breastfed child has a less chances of developing diabetes, hypertension, obesity, coronary artery disease, and cancer in the future. Mother's milk has less chances of contaminations. A cow milk goes through a supply chain and is more likely to be contaminated with bacteria. And bovine tuberculosis is very common in developing world where pasteurization is not commonly available. Exclusively breastfed infants have less chances of sudden infant death syndrome. Benefits in mother. The suckling reflex acts to release oxytocin from posterior pituitary, which helps in milk letdown and also immediately helps to contract the uterus and prevent postpartum hemorrhage in case of uterine atony. It also helps in uterine involution to the pre-pregnancy state. The anterior pituitary releases less luteinizing hormone and follicular stimulating hormone because of breastfeeding, due to which ovulation does not occur and hence lactational amenorrhea. The pregnancy doesn't occur in first 6 months after childbirth because of lactational amenorrhea, but it is advised to use a method of contraception in case of failure. Mothers who have exclusively breastfed their babies have decreased risks of developing breast and ovarian cancer in future. The shedding of cells in breast milk help remove potential DNA damage cells, thus helping you reduce the chances of developing breast cancer. Whereas breastfeeding also can help lower your ovarian cancer risk by preventing ovulation. Breastfeeding mother lose less calcium in urine and have increased bone-forming osteocalcin, whereas non-breastfeeding mothers have higher chances of osteoporosis and resultant fracture in future. Breastfeeding benefits the family and society. A breastfed child is happy who cries less, saving your time, and there is nothing to prepare, buy, or clean if you breastfeed your baby. Breastfed children are less likely to be ill and less expenses on health care by an individual family and a government as a whole. And buying a formula milk becomes so expensive. This video is made possible with the help of pediatric doctor Deepak Paudel. Thank you for watching this video. If you like to watch more videos in future, please do subscribe to this channel.